Okay, so now we are going to look at topic that is PONV, post-operative nausea and vomiting. So why PONV happens? Post-operative nausea vomiting happens because of pain, because of residual drugs of anesthesia, or because of any inhaled anesthetic that can cause PONV, post-operative nausea and vomiting. So these are some of very common causes of PONV, and I will be showing you some other related factors as well, like anesthetic related factors, volatile anesthetics, nitric oxide, postoperative opioids, and long duration anesthesia can also cause postoperative nausea and vomiting. So anesthetic techniques to prevent this is preferred propofol based anesthesia or TIVA, avoid or minimize volatile agents, nitric oxide, and use regional anesthesia in the patients who are more prone to PONV. So, nitric oxide, inhaled anesthetics, and opioids should be minimized in patients, and preference should be given to the regional anesthesia like spinal anesthesia. So, analgesia techniques are NSAID, paracetamol, or regional blocks are required in patients who are more prone to PONV. So postoperative nausea and vomiting. Another one is management. It is very important. We have to manage according to the patient. 5-HT3 receptor like on CGAT is very important for management of vomiting, postoperative nausea, vomiting. 5-HT3 antagonist and receptor onset corticosteroids, dexamethasone, dopamine agonist, domperidone, antihistamines, anticholinergic, scopolamine patch. These are very important for management of PONV. So another one is nucleus tectus solitarius, final common pathway, integrate all emotion and activates the vomiting center. And this is the pathway for PONV. So patient will have nausea, vomiting, and that signal goes to the nucleus tractus solitarius, and GI vagal afferent activation results into vestibular system and cortex. And then 5-HT3 receptor antagonist should be given that block both central and peripheral emetogenic pathway and prevent vomiting in PONV. So this is management for PONV, that how we can manage. So let me show you some of the PONV management methods. PONV management. Okay, here is PONV management. As you can see in this image, this is perioperative can happen in if age is more than 3 years, history of PONV, motion sickness patient or post-pubertal females, intraoperatively in strabismus surgery or autoplasty or surgery more than 30 minutes, volatile anesthetic and anticholinergic can cause PONV. So some medical risk factors are also there like opioids, and treatment is we have to use all of these agents like metaclon, oncegate, 5-HT3 receptor blockers, and antagonists, and we have to manage that and treat the patient, and we have to prefer a spinal or regional anesthesia as well. So there are different management practices, like men has two antiemetics, dexa onset. In women there is dexa oncegate, domperidone should be given to manage the PONV, postoperative nausea and vomiting.